Greetings to the Commander-in-Chief of the EFF, Julius Sello Malema, the Deputy President, Nyiko Shivambu, all the officials, commissars, fighters, and ground forces of the only economic emancipation movement in South Africa. 10 years of the existence of the EFF has seen the lives of many of our people being made better without the dependence on taxpayers' money. Thousands of young girls across the country have missed less and less days of school due to period poverty because of the EFF Center Tower programs. Siyongoba Daycare for children with disabilities, Mokhalakwena Hospice and Rehabilitation Center, and Zanele Mtshali Disabilities Home are some of the facilities for vulnerable people that can attest to the care and the love of the EFF for the abandoned and neglected in our communities. Donating 30 Rand to the EFF by SMSing EFF donation to 42191 is truly a noble and charitable cause. A happy and a revolutionary 10th birthday year to the mighty economic freedom fighters. Chairperson, the National Health Insurance will be counted as one of the biggest scams of the African National Congress of our time. The ANC, through a Bill Gates mandate given in 2009, agreed to manipulate our people and convince them that equal health care for all would suffice through the NHI. We reiterate the long-held sentiments that the NHI, contrary to popular belief, is far from what it is said to be. The NHI is not the eradication of a two-tier system. No, the NHI is true evidence, and the fact that the only way to eradicate a two-tier system is through nationalization, not tenderizing healthcare. The NHI is the outsourcing of healthcare to the private sector through the pooling of funds of the hard-working South Africans and state coffers to fund the insatiable appetite for profit of institutions like Netcare and Life. Minister Joe Phatla, to date, has failed to appraise Parliament of the true cost of the NHI. And the Minister of Finance has also failed to present to Parliament precisely how it will be funded. The NHI is not...
Honourable Member, there's a point of order. What is your point of order, Honourable Member?
Sir, is it parliamentary for the honourable member to shout at us?
No, Honourable Member, that's not a point of order. Don't rise on frivolous points of order, please. Please continue. Order.
The NHI is not the easing of access to health care for the poor, as there is a referral system that is encapsulated in the NHI that states that we should all access health care at our nearest health facility. This means that those living in townships, in rural areas, in former settlements will still be subjected to the public health facilities. There's no developers emceeing on Asetogoza. In fact, public hospitals will be more debilitated as the money meant to better the infrastructure, increase the workforce, and provision of quality of healthcare will end up in the hands of private sector who will claim from the state the same way they claim from medical aids, and they have their customers leave their premises in utter humiliation, taken into public hospitals because they no longer have money. The NHI is a direct manifestation of what Ramaphosa administration truly represents. The fully fledged program to privatize everything and leave the state useless. All socialists should in fact with ease reject the NHI. The ANC government has privatized dams, national parks, state-owned entities, SAA, and a sold-off assets of Transnet, is instituting the privatization of ESCOM, and is in a constant motion of stripping the state of power, so it is unable to provide for the needs of our people, and we are at the mercy of the private sector for all aspects of our lives. The goal is to ensure that nothing in the public sector works. The goal is to destabilize everything in the public sector and empower the private sector. The status of our public schools, public policing and security, public institutions, and now public health care is evidence of what the program of the ANC is. When the EFF provided a solution of increasing access to quality health care for the most destitute through the private member bill, the National Health Act, Amendment Act, that was to see at least one health facility in every ward and that all the clinics open for 24/7 and 7 days a week. The ANC and the DA alike rejected this noble bill. This is because the mandate is not universal health care. The mandate is to loot the state of its money and put it into the coffers of the private sector. Prioritize primary healthcare prevention and education by employing all community healthcare workers permanently and bring healthcare into the houses of our people. Invest in stem cell therapy and numerous in medical interventions. Build clinics in all wards in South Africa and have them open for 24/7 and 7 days a week. Absorb all nurses that are sitting at home with qualifications. In-source all cleaners and security guards in all healthcare facilities. Build state capacity and stop depending on the private sector to solve your problems as a failing government. We reject this bill as we will not be part of the collective that sees the daylight robbery of the state by ANC gorgons who owe their allegiance to fellows like Bill and Melinda Gates at the cost of our people's lives. We reject the NHI.